Thank you so much, Doctor, for that. And I would like to further break down the question. Hence, we have so many health issues in the society. How fasting impacts diabetes patients? Since we have two types of diabetes, type 1 and type 2, how does this fasting make impact on that?
As you mentioned, the type 1 diabetes, people who are suffering type 1, they require insulin.
Means insulin dependent.
Insulin dependent diabetes.
All right.
They require insulin for body functions. Similarly, type 2 diabetic, they have insulin, but the insulin is not working. We call it insulin resistance. So type 1 insulin, the patients, they will be on insulin treatment. Type 2 diabetic people, they will be on a tablet. Some of the type 2 patients also
receive insulin.
Receives insulin. So these people should be very careful when you fast. Ideally, if you are uncontrolled diabetes, that means you are getting more frequent hypoglycemic attack, which is a low sugar more frequently, or hyperglycemic attack with DKA, we call it a diabetic ketoacidosis. These are the terms which use. These people are not stable, they are not controlled, their diabetes is not very well controlled. So they should be careful when they fast. Better not to fast.
So it's not recommended for type 1?
Type 1 unless they are very stable.
All right.
If the type 2 diabetes, of course, is recommended, you can fast, but you need to have a one-to-one consultation with your doctor and adjust your medication. There are lots of medication out there. You can have a daily medication, you can have a morning and evening medication, which you can take suhoor and iftar. So there are lots of options available. So they should contact the doctor and have a one-to-one consultation and plan their medical condition in order to fast properly. If you don't, there are complications during the fasting in terms of diabetic patient. They have a hypo, they have a hyper, that is a low sugar, and a high sugar they can get during fasting.
All right.
On top of that, because they are getting the dehydration, there are high chance they get a clot in the veins and a clot in the lungs. So the thrombosis, we call it, a chance of thrombosis is high. So these people should be very careful when they fast. So you need to have a medical advice.